Oh my gosh, what's wrong?
I'm really dehydrated, I have a headache, and I'm really lazy and I feel really dizzy right now.
That explains a lot because we're at the altitude of 8,000, so that's where altitude sickness comes in.
Why do people hyperventilate?
When you're up there and you don't have a lot of oxygen, your heart starts beating faster and faster to get more oxygen in your body, and so your lungs start inhaling and exhaling faster and faster to try to keep up with the amount of oxygen that you lose.
So Dr. Switzer, why do people get dehydrated?
At higher altitudes, the air is less dense, so you carry less moisture and less water with you. So when you breathe, you're actually exhaling more water instead of inhaling more water.
Why do people get headaches?
It has to do with dehydration and also the air pressure differences.
Why do people feel lazy?
People feel lazy because they get a lack of oxygen when they're up in higher altitudes, and you need oxygen in order to convert your food into glucose so your cells can use it. So without oxygen you can't give your cells glucose that they need, so you feel lazy and lethargic.
What's the treatment of altitude sickness?
Well, first you want to get the person rehydrated, so you're going to give them an IV. The next is you're going to slowly descend down the mountain, and you're going to stay there until the person feels like their body is getting back to normal. And then if you want to go up the mountain again, you have to make sure that you do it slowly.
Hi doctor, have you seen Josh yet? He seems really confused. He's been acting differently. He seems to be very tired. He has difficulty speaking, and he hallucinates a lot. Do you know what it could be? What are the risks of cerebral edema?
The risks are coma or death in really severe cases.
What's the treatment?
The treatments, oh, I have to grab this. The treatments include administering oxygen or giving them medication.
Have you seen Alex yet? He has difficulty in breathing at rest. He keeps coughing. He seems to be really weak. There's chest tightness and he has rapid heart rate. Is this also cerebral edema? How's the brain affected in cerebral edema?
Fluid leaks into the brain, which makes it swell. Actually, it's pulmonary edema instead of cerebral edema because the fluid accumulation in the lungs is what causes pulmonary edema. And it happens at about 2,500 meters. The initial cause of it is because the shortage in the air because of the oxygen isn't there, and it causes lower air pressure.
What are the risks of getting pulmonary edema?
The risks are genetics, sleep apnea, and a previous history of getting pulmonary edema. What makes them susceptible isn't well known.
What's the treatment?
The treatment includes descending as slowly as possible but as quickly as possible, and drugs.
Why is it important to start hiking low on the mountain and to ascend slowly?
Changes like lack of oxygen, air pressure, weather greatly affect the body and its organs. Without acclimatization, you can get altitude sickness, pulmonary edema, and cerebral edema, and so forth.